Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Heel injuries and disorders. Introduction. Heel problems are common and can be painful. Often they result from too much stress on your heel bone and the tissues that surround it. Certain diseases, such as rheumatoid arthritis, can also lead to heel problems. Treatments for heel problems might include rest, medicines, exercises, taping, and special shoes. Rarely, surgery is needed. This program explains heel injuries and disorders. It discusses the causes of heel pain and its treatment options. Anatomy of the foot and heel. The feet consist of many bones, joints, and soft, flexible tissues. Joints act as hinges. They separate bones. Joints, along with muscles, let the foot and toes move. The plantar fascia runs from your heel to the ball of your foot. It forms your arch. You may have a high or low arch. Low arches are sometimes referred to as flat feet. Underneath the plantar fascia is a cushion made of fat that helps absorb the shock of walking. The Achilles tendon connects your calf muscles to your heel bone. General symptoms. Heel pain usually doesn't mean that you have a serious medical problem, but it can make it harder to walk around, exercise, and do everyday activities. See your healthcare provider if your heel pain makes it hard to walk, happens while you are resting or sleeping, happens for more than a few days, causes swelling or bruising. You should also contact your healthcare provider if you experience heel pain and symptoms of an infection, such as a fever. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Plantar fasciitis. The pad of fat on the heel also becomes thinner with age. The plantar fascia does not stretch as well in adult feet as it does in children's feet. These two problems may result in swelling, bruising, or tearing of the plantar fascia. If your heel pain is on the underside of your heel, the cause may be plantar fasciitis. Plantar fasciitis pain happens when you first get out of bed in the morning. Some people say it feels like a knife in the heel. It may turn into a dull ache after standing for a while. The sharp pain will return when you stand up after sitting for a while. Achilles tendonitis. Achilles tendonitis causes tenderness or pain along the back of the foot and ankle, between the heel and calf. You may also notice swelling, warmth, and redness around the heel and ankle. The Achilles tendon can also tear completely or partially. This may happen if you stretch the tendon too much during sports or exercise. You may feel it snap or pop. Your lower leg and ankle will hurt a lot, and you may have trouble walking. Other causes. Heel pain can also happen if you have bony growths on the heel called heel spurs. Your feet roll inward when you walk. You have a chronic disease such as rheumatoid arthritis. Heel pain may also be due to a heel deformity, being flat-footed or having a high arch, bruises from walking, running, or jumping, injuries. Heel pain may be caused by certain lifestyle factors, including exercising intensely after being inactive for a while, running on hard surfaces, standing for most of the day, wearing shoes that do not fit or are not made well, carrying extra weight. Diagnosis. To diagnose the cause of your heel pain, your healthcare provider will ask you, how long have you had heel pain? what the pain feels like, when and where the pain happens. Your healthcare provider will also examine your foot and ankle for alignment, flexibility, range of motion, reflexes. Your healthcare provider may also order one or more tests to assess your condition. These tests may include X-rays, ultrasound, MRI. Treatment. Treatment for heel injuries and disorders may include lifestyle changes. If you exercise a lot, do a little less for a while as you recover. You usually don't need to stop walking or running altogether. Apply ice to painful or swollen parts of the heel twice a day for 15 minutes. Avoid activities that strain the Achilles tendon, such as jumping or uphill walking. When you do run, choose your surfaces carefully. Avoid hard or slippery surfaces. Don't do just high-impact activities like running. Introduce some low-impact exercises in sports such as biking or swimming. You can keep problems from getting worse by wearing shoes that fit well. Your shoes need to fit the shape of your feet. You might need one shoe in one size and the other shoe in a different size. Or you can just buy one pair of shoes in the larger size. When you are active, wear well-fitting athletic shoes with proper cushioning in the heels. Increase training intensity slowly. Achilles tendon injuries commonly happen after a person abruptly increases the intensity of the exercise. Increase your time and distance over a period of weeks and months. Your healthcare provider may recommend orthotics for flat feet or high arches. Orthotics are inserts for your shoes that provide arch support. Lose weight if you are overweight. This reduces the pressure on your heel. Place a padded mat on the floor if you stand for long periods of the day. Stretching exercises can help prevent heel pain. Talk to your healthcare provider to learn more about stretching exercises for heel injuries and disorders. Your healthcare provider can teach you how to do the exercises correctly. Medication may also help relieve pain. These include aspirin, acetaminophen or Tylenol, naproxen or Aleve, ibuprofen such as Advil, Motrin, or Nuprin. Talk to your healthcare provider before you begin taking any medication. If lifestyle changes and medicine do not help, your healthcare provider can suggest other treatment options. A splint, tape, or corticosteroid injections may help. Some people may need surgery to treat the pain. Surgery is often the best treatment option to repair an Achilles tendon rupture. If you have surgery, you will probably go through a rehabilitation program. This includes physical therapy. Physical therapy involves doing exercises that help strengthen your Achilles tendon and legs. It may take 4 to 6 months before you can resume all of your usual activities. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Heel problems are common and can be painful. Often they result from too much stress on your heel bone and the tissues that surround it. Certain diseases, such as rheumatoid arthritis, can also lead to heel problems. Heel pain usually doesn't mean that you have a serious medical problem, but it can make it harder to walk around, exercise, and do everyday activities. See your healthcare provider if your heel pain makes it hard to walk, happens while you are resting or sleeping, happens for more than a few days, causes swelling or bruising. If your heel pain is on the underside of your heel, the cause may be plantar fasciitis. Achilles tendinitis causes tenderness or pain along the back of the foot and ankle between the heel and calf. Treatment for heel injuries and disorders may include lifestyle changes. Medicines may also help relieve pain. Some people may need surgery to treat the pain. Thank you for using Explain.